In the House, it's Robert Dozier, Executive Director, Mississippi Independent Pharmacies Association. Good morning, Robert. How are you, sir, on a Monday?
Good morning, Paul. How are you today?
It's good to have you. I'm a little perplexed on this one. It is a complicated subject. I figure if it's hard for Gerard Gibbert to understand it, I don't feel too bad. But I've read through this and the bill itself. It's rather concise. But first of all, how does the Independent Pharmacies Association look at this, pro or con, or what's the thoughts from your group?
Well, the Mississippi Independent Pharmacies Association, they're the ones who have brought this to the legislature to try to pass it, and to pass a piece of legislation that will add much-needed transparency in the prescription drug world. The pharmacy benefit managers, the insurance companies, the managed care companies have for the past 30, 40 years let's say bamboozled the business sector out there, the business groups, and they have basically been selling them a false bill of goods over the years, and it's just been raising prescription drug prices over and over. Paul, you know the textbook definition of insanity is doing something over and over again and expecting a different result. So in this part of the world that we live in with healthcare insurance and prescription drug insurance, the employer's cost is steadily going up. The beneficiary, the employees' monthly premium, yearly premium, their co-pays are going up, and the pharmacy's reimbursements are steadily going down. So where's the problem? The problem does not lie with those three entities that I just mentioned. The problem is the man in the middle, and that's going to be the pharmacy benefit managers. It's going to be the insurance companies and managed care companies out there.
You heard Scott's, did you hear Scott's or read his column?
Yes, I saw the update.
How do you answer here? Because it seems the sticking point here is that some of the members, and again, I think Scott said this more than once during the interview, that this was not just a, let me look at it and offer a quick retort to this, that some very knowledgeable people in his membership and many of the businesses looked at this. They did a deep dive in it, and they're worried. I think at one point they said no adjustment for dispensing fees in this bill, a couple of dollars today, 50 cents to a couple of dollars today. This would raise the dispensing fees to $11.20 per prescription. That's just the beginning of that. Well, how do you address that?
Paul, I'm glad you asked this question right here. Actually, what we're trying to do is increase the dispensing fee to $11.29, not $11.20. So, a pharmacy's reimbursement, and this is where the business community is not looking at the entire formula. Okay, the pharmacy's total reimbursement is made up of two components: the cost of the drug plus the dispensing fee equals the total reimbursement. What we're saying is let's move to a more and much needed transparent reimbursement methodology. Let's use NADAC, National Average Drug Acquisition Cost, which is the pharmacy's cost for the drug. It is a published number published by a independent third party, CMS, Centers for Medicare and Medicaid Services. Our cost of the drug will be published on an open website that you, the public, Perez, anybody can see. So you take that number and you add it with the $11.29 dispensing fee, which the $11.29 was based on a statewide survey back in 2017 by the Division of Medicaid. That's what it costs to dispense a prescription at a pharmacy in the state of Mississippi.
But are you saying that will be tacked on to the cost of what a consumer pays for it?
What we're saying is the pharmacy benefit manager will reimburse the pharmacy NADAC, cost of the national average drug acquisition cost of the drug, plus an $11.29.
Is that the average wholesale price? Is that what we're talking about?
No, what we're talking about is NADAC. NADAC is based on monthly surveys done all across the country, and that is a true reflection of what the pharmacies pay for that particular drug.
There is so much that goes into this, Robert, that people don't understand. Number one is by the way, is some of these managers out there They're actually subsidiaries. Are they still subsidiaries of places, of people like Centene?
I think Centene has kind of gotten out of the PBM business.
Have they, or
I think after all of those settlements that they've had to do with all the states across the country, I think they've gotten out. I think they're kind of in the managed care business and the insurance business now.
Now, you represented as executive director of the Independent Pharmacies Association. Does this also go for the chain stores, or are they under the same thing here?
Yeah, chain stores, retail pharmacies, yes, sir.
And they feel the same way about this bill?
The retail pharmacy community is needing a much change in the reimbursement methodology to reflect the true actual acquisition cost.
Yes or no, this will or will not raise the cost of medicine prescriptions for consumers?
Well, that is a that's a very good question. Thank you for answering that again. What we're saying is this is going to reduce the cost of drugs probably by about 5% overall. This is going to reduce the overall drug spend for consumers out there. And
is that immediate, or would that be gradual over a period of months or years, or what?
Well, as soon as we get into, if we pass NADAC plus 1129, we will start seeing the much needed transparency. The business community will start seeing the true transparency that's going on out there.
Is insurance going to take up most of that cost, or is that going to be written into the insurance part of this, or how does that work out?
Well, the PBMs, they do not want this because it's showing the transparency back to where what's really going on in the prescription drug world out here.
So is it mostly just getting a better formula or equation to figure out what the actual cost is? Because when they come up with a new drug, or whatever the drugs happen to be, we really don't know what their cost factor is. When most of the data that I've done research on, this AWP, the average wholesale price, they said that's the worst possible methodology that you could use.
AWP, and that is what the pharmacy benefit managers, insurance companies, managed care companies, anybody who reimburses pharmacies or anything, that's what they're using. And that is one of the most outdated metrics that's out there. And I don't know if you remember this, Paul, but several years ago, probably 10 years ago, Attorney General Jim Hood and several other state attorney generals, they sued over AWP methodology, and I think the settlement was probably somewhere around $20-25 million back to the state of Mississippi. So for these business owners out here, if they still want to use the AWP methodology, they're doing themselves a disservice. NADAC is cost that the pharmacies pay for that particular drug. And then the $11.29, that is how much it costs the pharmacies out there to dispense that drug. So the pharmacies of the state of Mississippi, they're showing the world their cost. They're showing them.
How do they arrive at this? All of the people that have been put together and done a deep dive in this as far as the businesses, how are they arriving at the fact that this is there's some holes in this bill that could be shored up a bit?
Well, because what they've done is they have allowed themselves to be scared by the PBMs and the opposition of this, and they're only looking at the increase in the dispensing fee. They're not looking at the total formula, just like I told you.
You're saying when the savings roll in, and I think you quoted 5%, it will usurp that $11.20 basically.
Yes, the savings is going to be on the NADAC. NADAC is going to lower the drug cost tremendously. That is going to offset the increase in the rise of the dispensing.
And if it doesn't?
What do you mean? If it doesn't?
If it doesn't, I guess one of the things that, as the purchaser out there, just a consumer, we don't trust these people. We really don't. The PBMs, these people are doing. Look, this thing is so big as healthcare is concerned, and big pharma. It is. I'll give you more time when we come back in a second. We've got a break coming up. But I'll be honest with you. I think most of us, if you ask, can a congressman do anything about this? That's not on the take, and I say getting some money. How many people we have in the state legislature that's getting money from the health insurance lobbyists one way or the other? I don't even know if the President of the United States of America can stop this train here with the influence that Big Pharma has. And the PBMs, how much money do they make a year?
A running ton.
Yes, with B's on the front of the tons.
Correct.
So, I mean, is it just so big? Is this just taking a bit of a bite out of it? I'll let you have the last say, and we'll have more with Robert Dozier coming up next. To the Trustmark Studios, Robert Dozier, Executive Director, Mississippi Independent Pharmacies, my guest. You asked, what do the PBMs make? They don't make the drugs. They really don't provide it to the hospitals. I mean, the pharmacies are in between there. There's a lot of people in between. But what do they make? And they don't make anything, do they? They just
probably
they're middle people.
Exactly. You hit the nail on the head. They're middlemen, and the pharmacies are out there. They're doing all the work. They're taking care of the patient. They're supplying the medication. They're doing the medication therapy management and everything else like that. The PBMs really started off as third-party administrators, and they're processing claims. That's what they're doing.
And they were there for what, Robert? To hold costs down?
That is their claim to fame. But
yes.
When's the last time you saw drug prices going down, Paul?
PBMs generate here. I just found this figure here, and I think this would be updated because we ask, what do they make? PBMs generate some $315 billion every year. $315 billion every year from 5 income streams that include rebate sharing, pharmacy spread, PBM-owned pharmacies, and administrative fees, and also DIR fees.
Paul, you are 100% correct. And let's say this. Let me take this Senate Bill 2484 a little step further. We're talking about NADAC plus 1129, but also in the bill, we're asking the legislature to eliminate spread pricing. And spread pricing is, and these are just hypothetical numbers for conversation, spread pricing is when the PBM reimburses the pharmacy $5, and then they turn around and they charge the employer group $50, and there's a $45 gap right there. That PBM keeps that $45, and they have not done anything for the benefit of the patient. Nothing.
Robert, are there some states that don't use PBMs?
Some states, like in the commercial market or in Medicaid or what? Well, some states are looking into getting more away from managed care and more into fee-for-service. Whereas here in the state of Mississippi, Medicaid has fee-for-service, and we also use 3 managed care companies.
Has this bill that you have, and apparently you've provided the language of this to Senator Parks.
Correct.
Is this bill mirrored in any other state legislature?
The NADAC plus language is being done in West Virginia for commercial markets.
But they haven't had a year of trial to see if it actually works.
They passed this in 22, and they came back in. No, they passed it in 21. It went into effect January of 22, and they came back and they did some modification to it. I think they added some penalty phase enforcement stuff to it, and that went in January 1st.
And they're seeing results from this?
I talked to my counterpart the other day in West Virginia, and he said that everything seems to be going good. They're starting to try to maybe do some surveys or something of that nature. But
well, here's the reality of politics on this one. We're in an election year, and if you do this, it becomes effective, and the governor signs it July the 1st. Am I right? July the 1st.
Yes, that's the way the bill reads.
So you have right July, now. August, September, and October. That you got to hope to God that there are no price increases or higher costs, and the pharmacies telling you that it's going to be a little bit more, because then you have a November election, and from the governor's race all the way down to the representatives race, House and Senate, I should say, it's not going to be good news if it doesn't work.
Well, the thing is this, Paul. 43 states across the country use NADAC plus in their Medicaid offices. Okay, 43 out of 50. The other 7 are using NADAC plus an average acquisition cost methodology, state specific. And Mississippi's been using NADAC plus 1129 in their Medicaid division since 2017. So if this was bad, don't you think the legislature and Drew Snyder over at the Division of Medicaid and others would have pulled this out by now?
Well, but then Scott makes a very good point. He said if it's truly cost savings, then why has the legislature chosen to include the state's health plan, which covers them? If there's true savings, $190,000 of that coverage. If there's true savings, $190,000 that coverage. If the state plans adhere to this bill, it would cost an additional up to $30 million. A projection. In other words, they're saying that if the membership of the House and Senate thought it was that great, let them adopt it.
Well, Paul, thank you for saying that. Asking that question. Here's the deal. Senate Bill 2484 addresses the Pharmacy Benefit Prompt Pay Act. We passed that back in 2006 to address the problems that pharmacies were having with PBMs in the commercial market. That the state health plan has never been in that act, okay, since 2006. That is a smokescreen by the PBM opposition and everything. If we have a problem with Medicaid, we will fix those problems in the Medicaid Technical Amendments Bill. If we have a problem with state health plan, we can go to the insurance code sections that deal with state health plan out there. Now, I've had some conversation with individuals that claim these numbers are going to rise and everything for the state health plan, and I've asked, what are you basing these numbers on? And it's always been the increase in the dispensing fee. It's never really been taken into effect, the lowering of the cost of NADAC. Now, if the legislature wants to put state health plan in with the NADAC and everything, the best way to do it would be put it in a state health plan code section out there.
I would imagine this is as difficult for a lot of guys who are not used to this industry and know the verbiage and the lingo that you guys use, but rank and file in the House and Senate, these guys got to study this bill because to create a new section that will prohibit health insurance health issuers and pharmacy benefit managers from certain discriminatory practices relating to entities participating in the program. So there's so much in here that you try to read in this bill, and it's hard to understand because there are a lot of people who just don't know your industry. But
Paul,
we count on you as the executive director of the Independent Pharmacies Association to just give us a yes or no. And this is not going to cost us more money. Ultimately, it should save us money.
And the bottom line, it should save the consumer, it should save the business community more money, and it starts to show what the PBMs and those other entities are truly doing to everybody else out here.
Yeah.
They're the ones that are making all the money. They're the ones that are in control of everything. Pharmacies, they have no negotiating ability whatsoever, and so that's why we're having to come to the legislature to try to pass something like
I will say this. I know that our hometown pharmacies have been under the gun, and we go to in half a year's one and to pick up a prescription over the weekend, and there was nobody there. The lights were off. The lights were off, and this is Walgreens. I hate to tell you this, but the lights were off. This is midday, and I'm not sure. And then we go back, and there's a sign that they take off for lunch now.
Well, let me.
Are we having a shortage of pharmaceutical students in class, or what?
What you're seeing across the industry right now are pharmacies are having to cut some of their hours back because of these the monopolies that the PBMs have caused, and they're having to shut hours, they're having to cut cost by cutting employees and everything else like that. Pharmacies across this state are barely keeping their lights on. And here's the thing. If we don't do something to protect the pharmacy community, we will have a health care problem in the state of Mississippi. You will start seeing pharmacy deserts all across this state, and therefore you will have a problem. Now, do you think that PBM is going to be able to take care of Miss Smith like that independent pharmacy in her hometown? No, they will not.
Yeah.
If I can just say this, Paul, a message to the business community. If they're sitting here scared to death and all they're hearing is the increase in the dispensing fee, well, guess what? If I haven't convinced them that this isn't going to be a good thing for them, and we're trying to do the right thing, we're trying to add transparency, pick up the phone and call their local pharmacist. It doesn't matter if they work at a chain or if they go to an independent pharmacy. Pick up the phone and call them. Ask their pharmacist what's really going on in the prescription drug world with these PBMs out there. And then they'll start getting the idea. I mean, we just talked about spread pricing a while ago, and the disclosure of rebates. That is something else that's in this bill right here that the business sector and the PBMs don't want to talk about.
What was that?
The disclosure of rebates.
On the rebates, yeah. We have final segment. I'll give you the final word in a moment or two, but I'll say this, and it's been a it's been a thorn in my side that in certain channels are more than the other, but every other, if not every commercial, is a pharmaceutical commercial out there for heart thinners or whatever it happens to be, and that's the biggest things now after COVID shot, of course. But the last we heard, they spend literally tens, if not hundreds of millions of dollars a year on prescription drug advertising that the consumer can't do anything other than just mention to their pharmacy about. And from the last we heard, they're spending more on advertising than actually on research. And the NAB, which is the National Association of Broadcasters, is one of the most powerful lobbyists in Washington, D.C., so I don't think the advertising is going to be cut anytime soon. Just a little bit of a carrot out there. Final segment's coming up next. Live in final segment here with Robert Dozier, Executive Director, Mississippi Independent Pharmacy Association. The C-Spire text line is bombarded with a lot of good questions, too. I did notice here, because I was reading 2484 during this, and I noticed about line 115, it specifically excludes the state plan. So it does put that in the bill. Well, that the state plan is excluded. Would you be willing to have Senator Parks or add an amendment to take that out?
That language has always been in there since 2006. And also, don't forget, Medicaid is right up under that as well, too. And that's what I was telling you a while ago, that Medicaid can be addressed in the Medicaid tech bill, and the state health plan can be addressed in state insurance code sections. And that's what I'm saying. You know, this right here was for intended purposes for commercial plans and commercial plans only.
But again, it's in there. It could be taken out, could it not?
It could be, yeah. Medicaid could be taken out as well too.
Well, I mean, it's not an either or. They could just include the state legislature within this plan.
Yeah, but you know, and that's the whole thing, Paul. In Mr. Waller's article, he was saying that the Senate, was taking this out and everything. It's never been carved. It's always been in there to be excluded, because of this has always addressed commercial plans right here. And this is not the first time we've talked about this issue as well either. Hank Zuber and Senator Walter Michel, they had some hearings concerning the state health plan back in late summer, early fall. We had this same piece of legislation that came up last year. It did not pass. Chairman Ha Bryan had a hearing on this bill right here several weeks ago, and then they had a committee meeting on this bill right here. So there's been a lot of discussion on this bill and this issue already.
You would challenge Scott Waller's assertion from the data that he's received from his members across the state that this could add up to $30 billion in cost?
Did you say $30 billion?
$30 million.
Oh, $30 million. Yeah, I want to see his data. I want to see where he's getting that, because, like I said, everybody I've talked to in the business community is focusing on one thing, the rise in the dispensing fee. They're not looking at NADAC and how NADAC will lower the cost of the drug and more than offset the rise in the dispensing fee. Here's the thing. I go again one more time. Pharmacies are one of the most trusted professional individuals in this country, one of the most trusted professions. My board of directors would not have allowed me to introduce this legislation if they thought it was going to be bad for their patients and also the business community as well. What this bill is doing is it is adding much needed transparency to the prescription drug world that we know is a fair and totally transparent reimbursement methodology. We are taking the ability right now with this legislation to eliminate spread pricing. That does nothing for the pharmacies out there. That helps the business community. We are talking about disclosure of 100% of the drug rebate money that the PBMs collect, and they keep 9 times out of 10. a lot of people don't even know that the PBMs are collecting this rebate money from the drug manufacturers on their behalf.
Oh, they collect $315 billion total
that
every
should
year.
be passed on to the business community and their beneficiaries.
Before time runs out, I think we've covered this quite a bit. Any other bills in the state legislature that's cleared and is still alive that affects the pharmacies in the state?
Yeah, there's one out there right now. It's
that scope of practice was one, was it not?
Well, it was a test and treat out there by
test and treat.
Representative Lee Yancey over on the House side.
Which would do what?
It would allow the pharmacies to be able to test and treat for certain diseases like flu and strep and everything, and then be able to treat them if you tested positive for flu.
So in other words, you come in, you got a cold or something, they can test you and see you have flu or just a regular common cold and give you a shot that matches that?
That's correct, yeah. They would have to go off of a formulary, a preset formulary and everything else. Hey, Paul, pharmacists stepped up to the plate during COVID. You got a lot of pharmacists out there that they were testing for COVID, and then they were also providing the COVID vaccine and everything. So pharmacists are a very important part of this healthcare chain that we have.
Well, realistically, it's hard to say that that's much of a scope of practice increase when they already get flu shots, so it's it's a little difficult to argue there, but
that's correct.
We'll see what happens, and it is still alive.
That's correct, yes, sir.
This bill has passed the Senate, where we're talking about 2484?
No, it is on the Senate floor.
It's still on the Senate floor.
Yes,
okay.
it's on the Senate floor.
Sure. Somebody asked me that.
And let me be clear. It has a reverse repealer in the bill right now. And Paul, you're familiar with the reverse repealer
But again,
process.
I think your transparency is going to be immediately after the passage of this, and you got 3 months, August, September, and October before the election. So transparency will be there one way or the other from the voters.
Look,
Robert, good job, sir. Appreciate it. You made it as simple as possible.
It's always a pleasure seeing you, Paul.
Love to see you back. Appreciate it. Robert Dozier, Executive Director, Independent Pharmacies Association.